Hi, how are you?
Welcome,
Good.
sir.
Well, last time I was here, I was talking about diagnostic, especially about fascia system, which gives you a big idea of the whole body because fascia is interconnecting everything. So fascia is very important. And now I'm going to try to explain you why tools are so useful in manual therapy. Because normally I believe that my hands are the best tools, but you will see that we can increase the effectivity of our hands using the tools and being more precise. So first of all, we have to make a good diagnostic. Once we have the good diagnostic and we really know where to treat, how to treat, and all the parameters, then we can decide where we can apply the tools, and then we have a very high effectivity. So let's go on. First of all, with the tools we have power transmission. So one of the things that we have in our hands, or the problem that we have with our hands, that sometimes we don't have enough force, or we don't can maintain the force the whole day. So a tool that helps you and allows you to apply the right force during all the day will be significant in your results during the practice with your patients. Imagine that at 8 in the morning you are very fresh, you can do everything, but maybe 8 p.m. If someone very strong comes and say, hey, I want that you check my muscles and that you give me a good massage, then maybe you are not able to do this treatment because you're very tired working the whole day. So the tool will allows you to have the force the whole day, and also many times there are physical therapists, very thin one. They are no powerful, and some patients don't like to be treated by them because they say, oh, they don't have force, they don't can go deep inside my tissues. So this kind of physical therapists, which have a restriction and don't reach us other physical therapists, they don't have no problem using a tool because the tool allows them to reach and to take care of the patient as any other physical therapist without any kind of restriction. So the effort that the physical therapy needs to treat the patient decrease, and this allows the physical therapist also to get a bigger resistance, so to be able to work the whole day with the same strength without limitation. This is very important to apply the right parameters during the whole day and not just as you are able to do. Also, the tools allows you to increase the effectivity of our hands, increasing the speed during the manipulation of the tissues. I will explain it a little bit forward why it's so important. The inertia and the heat. Also, we will have better grips because the tool is stiff and don't get deformed. Our hands have a lot of joints and we have to fix everything to hold and manipulate the tissues. And with the tool which don't deform, where we don't have to use force to hold the hand in this position, it will be much more easy. And especially we will have also force vectors with the tools which are more open or more higher variety of vectors in comparison with the hand. So all this I'm going to speak a little bit more forward. And the tool also will maintain and improve our sensibility, which is very important because I'm going to explain that we're using normally the fingertips to treat and to feel, and as much more we treat, as less we feel because we get under stress. The fingertips, where are the sensors, and this is a limitation of sensibility, which using the tools never happen because the hand is relaxed. I will explain a little bit forward. And this increase much more the sensibility that you will have, and also the comfort for the physical therapist because we are walking normally 8 hours. So our posture, our movements, our overloads of our own body will be also important, not just in this day, for a week, for the month, for the years that we're going to work, so that we'll be able also in higher age to be as much effective as when we are young therapists. Okay, what or why we have to use tools in manual therapy, especially when we try to increase parameters or the manipulation of the tissues, which has an implication of torsion. Torsion is something like that, that we turn over. That is a kind of stretching. So when we turn our arm or when we turn the tissue in this way, when it's stretched, we increase the stretch. So we make an elongation of the fibers, especially of connective tissue fibers, also muscle fibers, obviously. And this is very important to show the tissues in which way we need that they have to be longer or more elastic. So if there's not an input, the tissue can react, and make this kind of torsion is very difficult with the hands. But with the hooking the tissue, then we can manipulate it much more easy. Also, everything which is compression is much more higher is the compression, much more the fibroblast of the connective tissue reacts, building or producing more collagen fibers, which increase the force of the tissue, make it more resistant, more stronger to resist other impacts, especially in sports. And these fibers have to be guided, because they have to be in the right direction. For this, again, traction will be very important, as we mentioned also the torsion maneuvers. And sharing forces are very important because you remember when I explained it in my last webinar, the connective tissue is like layers. Between the layers there are interconnections, and if the connection between the layers are too strong, it's very difficult to move quietly perfect. So with sharing forcing, with opposite forces, it's very easy to reduce this this interconnection, or this bad interconnection, which is called also crosslinks. So we can remove these crosslinks with a high input, and so restore the movement between different tissues. But all these are normally maneuvers or techniques which are quite difficult to do with the hands, but very easy to do with the tools. Oops. Okay, next one. So the fascia, you see here a picture, you see all these fine cables, which looks like a spider web. It's not a spider web, it's a connective tissue inside the body. And this spider web can adapt a little bit. All these fibers can move a little bit to the direction in where it is stressed. So if I pull it from one side, all the fibers try to go in this direction. Science a limit, but if the input of this information is quite often, a few times a day and all the days, all this tissue will get more and more directed in the direction which is requested for the use of the movement that the patient specifically needs. So if we have clear this information that the connective tissue works like this, it means it needs a lot of traction, different kinds of traction. It needs shear forces to reduce the interconnection of the crosslinks. So if we are able with movements to make it, let's try with the tools replicate these movements, making the strokes, making the movements, just to stress this connective tissue in the best way. And this, to do it with the hands, is very difficult because normally we use cream or oil to slide better and to be more comfortable with our hands. But in reality, to make this kind of forces, of shear forces, of stretching and torsion, we don't need, or we don't have to use oil, because if not, our hands slide on the superficial and we don't take the skin and all the layers below the skin. We don't move them, we only compress them. So compression, remember, only produce more collagen fibers, but we have to tell them in which direction we need them. So we need, in reality, a lot of torsion, we need a lot of stretching, the shear forces that we can do with the tool, because the tool hook or hold or stretch the tissue, because we don't need lube, we have a very good grip on the skin, and we can work, or we have to work as less lube, oil or cream as possible, just to allow to protect the skin, because we are sliding a lot about the skin, so we can have a little bit of damage in the skin. This will reduce a little bit with the cream, but just to protect, not to increase the sliding. And this is very difficult to do with the hand, because with the hand, if we work the whole day, we deform our own tissues, and excess of deformation gives a hypermobility, and this is not good for our fingers. So to prevent us to have problems using the right techniques, we need the tools to apply the right techniques to have the biggest or the best results in reforming or restructuring this kind of tissues. So we have to transmit the right parameters. Parameters mean the right speed, the right direction, the right compression, to work superficial, to work more deep. Sometimes this technique, especially high-speed techniques, will be difficult for the hands to manipulate, but with a tool, with a biomechanical application of the tool, it will be much more easy than making very fast movements with the tool. Toc, toc, toc. It's very, very easy and increase the effect. And the right parameters are very important to resolve the problems of the tissue. If we don't apply the right parameters in the right time, in the right direction and everything, the effectivity of our treatment decrease and we lost the effectivity. So obviously the limitation of our hands are holding the right position, making the right pressure, feeling exactly everything which is happening, especially when we're making high pressures. As higher the pressure is, as less we feel, and the tool will allow us to transmit the right parameters without losing the sensibility in our hands and being as much effective as possible. So the tools offered us just to resolve all the things that the hand is not be able. So we have the best of our hand with the best of the tool. In combining both together, we are much more effective as using only the hand. In sports, you can make a fault, especially in Olympic Games. And the first time that we have a lot of representatives of physical therapists from worldwide using the tools, the Richelli's tools in the Olympic Games, and Rio was very, very strong. And obviously no athlete will be treated with a technique which don't resolve his problem immediately. Because they can say, oh no, I will give you a treatment and it will help you in 2 or 3 weeks. No, in 2 or 3 weeks, Olympic Games are empty and I need it now, today. This afternoon I have a competition, I have no pain, so you have to resolve it immediately. So the tools allows you very, very quick to have very short-term effect, which applying them in the right way, they will have also long-term effects. But the nice thing of the tools, they have resolved it immediately, especially changing the viscosity of the connective tissue, of the ground substance inside the connective tissue, which allows to be more fluid and so increase the movement between the different layers, and also changing a little bit this structure of connective tissue, allowing to orientate to the direction where it's more required for the movement of the athlete. So these are the quick short-term effects which endure about 2 or 3 days, but doing the right exercises combined with the techniques, doing with a requirement of once a week, so we can have also long-term effects. But in sports, the short-term effects are very, very important because we have to solve the problem immediately. They can wait for a week or for the next day. In all sports, we can use it. Basketball, especially knee problems, ligaments, also after surgery, in motorbikes, a lot of broken bones, a lot of scares, everything is bad. So we need to recover them very fast from 1 week to another after a big injury. Also in football teams, very, very important, especially for recover the players after all the efforts that they do in each training and each match that they have. And cycling, athletes, any kind of sport is required of these tools, of these techniques, and obviously also any kind of worker, because a man who's working in building a house or doing something else, it's just like making sport. They are 8 hours working very hard, and to recover them, and especially very fast, is also important, because sometimes they can wait 1 week to feel better. They need to work next day, because if they don't work, they don't get paid. So to recover as much faster as possible, the tools will help you very, very good. So another thing to compare hands and tools are the force vectors. So when you are thinking in your hands, you have a bone inside and have soft tissue around. But to start to give a pressure, first you have to compress your own tissues where all the nerve endings are inside. So if you compress your nerve endings with which one you are feeling, as much more you compress them, much more earlier they get less sensitive. What I mentioned it before, you lost sensibility as much more force you apply it and as much more time you are compressing. So this is very important to know. And also, once you have compressed your finger thumb or your finger nipple or what else, it's a flat superficial. And this flat superficial I have only two force vectors, one down and one in front. So it's very restricted in force vectors. And force vectors, what they do is open tissue. So if you have more force vectors, as we will see next slide, we'll see you increase the effectivity of our techniques. So even the elbow, you use it maybe sometimes, it's just round, but the force vectors are quite similar to the fingertips of your hands. And I feel it maybe 15 years ago, before I started to produce the tools, that my fingers, after a week of walking, there's more in the morning, they are quite a little bit stiff, that started to be a little bit deformed. Also my elbow, when I put it on the table or just in the car, it hurts, it's not nice. And it's just because I'm using them too much, working with my patients. Science, I use the tools, my fingers are perfect, no swelling, no stiffness in the morning, and my elbow, I can put it where I want without any kind of pain. This is very important. Because we only have two hands, we can't cut them and put a new one, but we can change the tools if we don't like this specifically one, or we need another one for another technique. So look now on this slide and see the force vectors. In a round surface, all the force vectors goes in different directions. They are open. So when you're sliding over and moving the tool, you're opening the tissue because you're at the same time you're making compression in different directions. This helps a lot to reorientate and to stress the connective tissue in which we are impacting, obviously, with the tools, because, as I mentioned it, connective tissue holds everything together. Everything is rapid, everything is interconnected with connective tissue, and we can't let connective tissue outside and say, no, I'm only treating the muscle. No. As I mentioned it in the webinar before, proprioception requires the superficial, especially skin and superficial fascia, and is then a restriction of sliding, is a bad input of information in the brain, bad reaction of posture and movement, and then the muscle get more or less tired and the biomechanical change. So we have to restore everything, but we can also use the tools not only for fascia treatment, we can use them for muscle treatment, as I mentioned it before, with the sport teams, with football, soccer teams. They use it to make such a sport massage. So the tools are so nice that you can use it for any kind of manual therapy that you do, but increasing the effectivity using them, because they have a lot of advantage instead only using the hand. So how they work? Well, as I mentioned it, with the long pieces especially, we can move very, very fast, which first of all decrease the sensibility of the patient. If we make something superficial very fast, especially when someone hit us, the first what we do is something like that to reduce our own pain or making a strong compression. So using the tool in the superficial very fast decrease the sensibility of the patient, and so we can go a little bit deeper once it makes the effect. Also, the heat producing by the fast movement sorry, allows to decrease the pain, increase or decrease the viscosity of the ground systems, and also has a lot of blood flow increase in the area, which increase the metabolism in the area. This fast movement also increase the inertia. It's like a car. A car, when you drive with 50 miles per hour, you can stop it quite fast. But if you are driving 200 kilometers or 200 miles per hour, it needs much more time to stop. So when you're going through the tissue very fast, you move it over his restriction, and this increase, especially the displacement of the tissue, which increase the mobility and elasticity in the tissue, which is very important to restore the right movement in the tissues. So if you make a slow movement, the tissue reaches to its restriction and goes back. So in reality, you don't mobilize so much the tissue, but if you make it with a fast input, the tissue goes farther than when you make it just with a slow mobility. And what we try to increase is the mobility and elasticity of the tissue to ensure that the movements are free. It's like you have a suit on which is too slim, you can move well, but if you have a very brighter one, you can move perfectly. So the skin and the superficial fascia and all the tissue inside the body have to respect the mobility and elasticity. Okay, so main characteristics of the Richelli's tools. They are bright like a finger, so where the finger reaches, the tool also will reach. You see in my background and on the screen, the tool has a specific, the word could not come out, forms, which allows to reach each kind of tissue that you really want. You can hook, you can press, you can slide, you can make superficial movements, you can make deep ones. So depending which kind of tissue you want to reach, you can choose different parts of the tools. And we have 4 different tools. This is tools which we have now on the stream is much more for the whole body treatment. Then we have specific one more for the spine, specific one for the face and head, for very small areas, and another one for trigger points. So with the 4 tools, we covered all the necessaries that you have in manual therapy. So it doesn't matter if you're a sport therapist, if you're a neurological one, or what kind of therapies you do. Everything that you can do with the hand, you can applicate it with the tools. So the material is very close to Teflon. Teflon, you know, it's using to reduce friction. So these tools has the combination of easy sliding but good grip on the skin. So this allows to don't damage the skin less than the own hand of the physical therapist, but having a very, very good grip to increase these forces I mentioned before of traction, torsion, shear forces, and all this. So this is very important that we have a tool which don't damage the skin and allows us to apply the parameters, because we don't use oil or cream, just a little bit if it's very, very dry skin to protect the skin, but not to increase the sliding, which is perfectly allowed by the Teflon kind of material. And the tool also take the temperature, the room temperature. So if it's very cold, normally it's not hot, but in the moment that you take it in your hand and you put it in contact with the patient, it gets very, very fast the temperature of the patient, because it's not like steel or other metals, which needs more time to get heated on. This material immediately takes very, very fast the temperature, and also by the superficial sliding, it transforms immediately the friction into heat. So the tool gets warm and the patient don't feel something that impresses him as a core thing. This is very important. It's very light instead of metal, and as I mentioned, it's bright like a finger, so you can make pressure on it. Normally steel tools are very thin, and if you want to make a compression, it hurts in your own hand. It's not comfortable or not light, and they're also much more heavy, especially if you go in bigger ones. They are also very easy to disinfect. This kind of plastic or special plastic, you can disinfect it with any kind of disinfection material. The only thing that it don't resist is heat, because it's plastic, so it's hard to deform. But any kind of disinfection liquid, it's accepted. It's hypoallergenic. It's a material which is used in hip implantation, so no problem with allergical problems. Nothing goes inside the material, nothing goes outside the material. So it's very, very secure for the treatment of patients, so no reaction of hypersensibility or something like that can happen with this kind of tools. And special grips, as I mentioned it, if we want to hook a trapezius to make shear forces, to make a transverse, or to fix it and hold it and make very gentle movement with a strong stressing on the muscle, these are all things that allows the tools where the hand to hold this position or to hold the trapezius and then make a stretching with the head will be quite complicated, especially to hold the effort of your hand. Also, if you want to go very deep inside the tissue, it comes to a moment that your fingers are not able to hold this compression. They start to tightening a little bit, or the joints start to say, oh, help, it hurts too much. And also for contact which are not comfortable, man to woman or woman to man. Imagine you have to make a cross friction on the indentation of the adductor and the pelvis. Doing with your hand, maybe the patient don't feel comfortable. So if you're using a tool which maintains a certain distance with your hand to the body of the patient, this will be more comfortable. Or imagine you have to treat the breath of a woman. So to don't put your hand directly on the skin, just using more the tool will give then also a better or quite easier relationship with the patient, so it feels more comfortable. It has better sliding, I mentioned it before, but also not only on the skin, also on tissues. So imagine you have a kinesio tape on, you don't have to remove it to can make your techniques on the kinesio tape. So you increase the effectivity of the kinesio tape because you have still the tension or the release of tension that you applied applied with the kinesio tape. And on the kinesio tape you can increase these forces as you want. You can also go through right and left, and it's impossible to remove the kinesio tape or any other kind of tapes using the tool. And I also make some jokes in my courses, and I said, if someone is able in front of me that I can see it, that he removed the kinesio tape using my tool, I will spend a holiday with all his family in the place of the world where you want, all paid by me. So it's very, very clear that it's impossible to remove the kinesio tape. Also sport tape, imagine you have a ligament problem on your feet, you have to mobilize it, so you don't can remove it twice a day or each day to make your treatments. So on the sport tape, over the sport tape, through the sport tape with the tools, you can work very good because it slides quite easy and don't remove the kinesio tape. And also on tissues, so you don't have to take out your clothes to be treated, and especially for a person they don't like to be undressed in front of the physical therapist. Or if you're in a hospital in a big room with a lot of people, obviously you can take out all your clothes. So the tools allows you to be as quite equal effective on clothes than on the skin. I ever said better on the skin because the transmission of tension and torsion and everything is quite more effective directly on the skin. But if it's impossible, it's quite easy to work on tissues, which is very difficult to do with your hands. So we need to improve the sensibility. One thing that the people ever said is that they don't believe that with the tool you are much more sensitive than without the tool, using only your hand. And this is maybe the biggest limitation that I have, that the people start to use the tools because they say, okay, it will help me to be more effective, more the parameters, everything. But if I don't feel what I'm doing, I can treat my patient. But it's quite the opposite. You will see it. So first of all, remember what I said. If you make a compression, you compress your nerve endings. And if you compress your nerve endings, they start to reduce their sensibility, and then as much more you compress, you less sensitivity will have in your hand. So it's very important to make the transmission through the tool, and that your hands are soft on the tissue of the patient, very relaxed, and so they are more sensitive for much more time than if you use it just to compress. So you will have your hand on the patient, the transmission of the force will be by the tool, but your hands will still around the tool in contact with the skin of the patient, and also all the information is transmitted through the tool to the other hand, which it's in making the direction of the tool. So you have the sensibility of your hand on the skin, the sensibility which is transmitted through the tool on the hand. So both together guarantees you to have more sensibility. Oh, there's someone speaking between. Okay. Okay, so what I mentioned, a relaxed hand feels more than a stressed hand on the patient. And you will see on the picture, one hand is on the tool, on the skin on the patient, and the other one is making the direction. So you have both sensibilities, the sensibility which gives you the hand on your patient, which is relaxed, and the information which is transmitted through a tool. Imagine that you want to find out if a surface is flat or not. Sometimes you use your fingertip, but if you're not sure, you will use your nail, the nails, to see if it's quite flat or not. So why you use the nail? The nail don't have sensors inside. They have it at the end, but it's a stiff material transmit better information than a soft one. So this is why the cars have soft suspension, but the sport car has very strong one to transmit all kind of information to the driver that he can react immediately. So the tool will be like a stethoscope to hear the heart rate. They don't put their ear on the chest on the patient. They use it because the membrane vibrates easier and transmit more information to the ear of the patient as they use their own ear. So the tool will be like a stethoscope of the doctor to hear or to feel better what is happening inside the tissues. So to improve the sensibility of our hands, we have to guarantee to have our hands and the tool on the same time in connection. You will see it on the slide. The hands are under and the hook is making the compression with the finger, and both together are ever in contact. So you have the force transmission by the tools, but feeling all the time with your hands, which are more relaxed and don't have to make so much force in the area. And also all this kind of vibration will be transmitted through the tool, but for this it has to be very stiff, and especially when you go with the hands through the connective tissue, sometimes you feel it's a little bit more harder or softer, but with the tool you feel it's like there are little stones between. It look like a vibration which you will feel under. So it's much more information. Was the restriction of the tissue? What's more making this kind of noise inside, or this transmission or this vibration that you feel on your hand? Kind of information that you're not able to feel with your own hands. And another very good information when you don't use cream or oils is the changing of speed of the tool. So when you're sliding over the tissue or going through the tissue, you will feel that the speed increase, decrease, stop, increase again, much more or less. So this kind of speed changing and the sliding gives you the right information where's the restriction in the tissue. When you're using creams or oil, you slide just over and you don't feel, maybe you feel a bit, it's a little bit more harder, but this don't mean that in just this point, the tissue is more restricted in movement. So there's a little bit of confusion with your hand, which you will have if you're using the tools. So the tools increase your sensibility in a form that you never have believed before. And you have to try it. You have to see how it works, because the people still still need to feel it by themselves. Many times they don't believe me, but it's really like I explained, because your hand is relaxed on the skin. It's very fresh to feel everything which you have changed, and only the tool is making the changing, but also the tool gives you a lot of information which the hand by its own is not able to do. So tools are very important to work easier, to make less effort for the physical therapist, that they really can work the whole day with intensity, with all the parameters, everything that they need. It doesn't matter if it's 8 in the morning or 8 p.m. If he has a football team of 100 players or what else, it doesn't matter. Believe me, with the tool you can work the whole day with minimal of effort. Tools also allows you to be more precise, because we have also tools that are thinner than a finger. So sometimes where the finger don't reach, the tool reach, especially for very small ligaments in the hands or in some other areas. The tools are much more better. They also slide very good on hair. Well, I don't have, so I don't have a good example, but people that have a lot of hair, if you try to make a manipulation or treatment with their hands, you will stress the hair, and it's not nice. But with the tools, no problem. You can work on animals, on horses, on dogs, on cats. Many physical therapists which are specialized with pets use also the the tools. And what I mentioned also, the right parameters are very important, that we are be able to apply the right parameter that makes force, the deepness that we have to reach. Everything has to be guaranteed, and the fingers or our hands are many times not able to do it, and the tools will allow us to reach all areas. It increases the sensibility. As much more information you have, as much more precise and effective you will be also. And the impact in the fascia tissue is very, very great with this tool. So it allows you a perfect manipulation of the tissues. So this is the summary of all what I have mentioned. I hope you like it, and maybe you're more open to try to use a tool to make your own experience with them. So if there's any kind of question, I will be able to answer them all.
Yeah, thank you, Stefan, for this wonderful talk on the instrumentation. And summarizing it,